So the recovery after knee replacement surgery starts the day of surgery by working with the physical therapy team in the hospital. Whether or not you're going to go home the same day or stay one night in the hospital and then go home the next day, we get you up and moving the same day with the physical therapy team. That's our goal. You'll be ambulating with the use of a rolling walker at the beginning, right after surgery. And after leaving the hospital, I encourage patients to continue the exercises that they learned in the hospital with the physical therapy team until their first follow-up appointment. I allow my patients to shower 3 days after surgery with the bandage that they get after their procedure still on. That bandage can get wet while they shower. I urge them to just gently pat it dry afterward. While showering is okay 3 days after surgery, I still do not allow patients to submerge their wound underwater. So that means while showering is okay, no bathtubs, no hot tubs, no pools until cleared by your surgeon in the office. At about 2 weeks after surgery is when I first see patients in the office. At that point, we take off their surgical bandage, we check their wound, we make sure that everything is healing appropriately, and at that point, if everything is going as expected, we start them in outpatient physical therapy. Outpatient physical therapy is somewhere between 2 to 3 times per week, and it is a critical and crucial part to the recovery process, which I always stress to patients before surgery. Outpatient physical therapy generally starts with gentle range of motion exercises, strengthening the muscles that surround your knee, gradually working on range of motion throughout the coming weeks, and normalizing the way in which you're walking with your new knee. At 2 weeks is generally around the point where people start to wean off of the use of the wheeled walker after surgery and start to transition to using a single point or a 4-point cane to help them walk. By about 3 weeks after surgery, I generally have the expectations for patients to be able to fully extend their knee and to bend their knee to about 90 degrees. Gradually, over the next few weeks with physical therapy, your range of motion will steadily increase with the exercises that they give you at PT and then continue on a daily basis at home. At about 3 weeks after surgery, depending on the patient's progress, they may begin to drive as long as they are no longer taking narcotic pain medicine and they feel comfortable doing so. Once we hit week 6 is when I usually see patients in the office for their second post-operative appointment.